Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on, let's get between the sheets. This episode is sponsored by Boston Scientific and its educational website on erectile dysfunction, edcure.com. One study estimated that more than 50% of men over the age of 40 have some degree of erectile dysfunction, which can be frustrating and confusing. Go to edcure.com to find information on erectile dysfunction and treatment options, including long-term treatment options offered by Boston Scientific. Boston Scientific does not endorse any statements or opinions expressed during this episode. Hey, welcome back to Between the Sheets. We're going to have a return guest for the first time, which is very exciting for me. Sheena Rose Stelmack is a psychiatric nurse practitioner. She also does health and wellness and has her own clinic and all of these wonderful things. She is a wealth of knowledge. We had her on here before to talk about how our overall health, wellness, weight loss, all of those things can contribute to our sexuality. And today we're going to tap into the other side of her practice and tap into the mental health side. So I'm really excited to have Sheena on here today. So welcome back.
Thank you so much. It's great to be back.
Sex therapists on here who really delve into sexual trauma and mismatched libidos and things like that. But what we haven't had on here yet is talking about the mental health we all deal with on a daily basis, and some of us more so significantly than others, and how while you're dealing with these mental health issues, they can affect your sexual health and desires and things like that. So I'm really excited to tap into that side of things today because I have dealt with depression and anxiety for years and years and years and have kind of had to figure out how to navigate that with my sexual health throughout the years. So I'm excited to bring this topic to the audience today.
And there's a lot with this topic. There are so many ways that we can approach it. And when trying to break down talking points, I felt like we could have like a 5-hour podcast. So
yeah, absolutely.
Trying to get started on things, thinking about with sexual health and depression and anxiety, the chicken versus the egg, which comes first. So for some people, sexual dysfunction, issues with sexual health could lead to depression, anxiety. That's when working with a good sexual therapist is helpful. Now, thinking about if it's coming to more, are these symptoms affecting you in other places in life? So coping with your daily stressors, maintaining good relationships, productivity, whether, at work, at home, with kids, with family, being able to regulate your emotions, having a sense of purpose. All of those things are what we look at in mental health and help patients decide, is this an emotional issue? Is this a social well-being issue? And should we step into medication versus therapy? So keeping all of that in mind as it comes to sexual health, is the sexual health issues first, and that's leading to the depression? Is the depression leading to the issues with sexual health? So being very open with your provider so we know where to go with your symptoms.
Yeah, and I'm sure part of that is, your questioning too, and asking the right questions and getting them to be vulnerable with you. I know I love going to therapists, and I've had some really great ones who I feel very comfortable with. And I've had ones who, your personality doesn't just jive with, or they don't ask the right questions. And all of that is fine because somebody else is going to find that provider right in line with them. And so I always like to encourage people that even if you do go to a therapist for the first time and you don't jive, don't just throw therapy out the window. It just might be that therapist wasn't right for you. And you just kind of need to shop around. Just like medications. We don't always try the first medication and that's it for us.
Absolutely. And there are providers that you'll know if they're more or less comfortable talking about these topics. Some providers will prescribe medication, never even ask you if you're having any concerns, in the bedroom or any erectile issues. It's kind of just, they don't touch those subjects. There are some that are very open about it. Sometimes it is, a female to a female. Are they more comfortable? A male patient to a male provider, is that more comfortable? So seeking out what makes you feel most comfortable to have those conversations.
Yeah, it's interesting you say that because I do see, even in urology, I have some men who have a very difficult time talking to me because I'm a woman. And then I have other men who would prefer to talk to me because I'm a
Mhm.
woman because they don't want to admit certain things to another man. So
I've
you
heard
do really,
this.
it's very individual who you want to talk to.
Absolutely. I've heard exactly that, especially in therapy as well.
Hmm.
So it's
Yeah.
fine as a client, as a patient, finding what you're most comfortable, I think is important.
Yeah, that's fantastic. So when you have a client that comes in and they're talking to you about, their anxiety, their depression, maybe they're bipolar, whatever it might be, how do you determine whether or not it's affecting their sex life?
I ask. I
Okay.
am that provider that I will get into those questions and, not asking for nitty-ditty details or anything like that, but just asking them, are you dating? Are you in a relationship? Are you married? How is that relationship? Are you guys spending time together? Are there issues there? And really just getting a good baseline, encouraging patients to be open about it, talking to them. Again, what we explained, are there other stressors that are creeping into other parts of life? So knowing a good baseline before even thinking about prescribing, because
Hmm.
certain medications we could help with sexual health and we can help with boosting depression symptoms, addressing anxiety symptoms. There might be certain classes of medications that we'll want to avoid completely based on the answers that I can get from that.
Yeah, and then I would imagine that if you are trying these medications and things that would be an ongoing discussion too, right? Like, okay, this is where you're
Mhm.
at before we start any treatment. Now where are you at? Because we know some of these treatments, like you said, can benefit and some of them can even hinder things and make things worse. And so it's definitely an ongoing thing. Where do you start with kind of pulling back the layers of, do you just go straight to medication? Do you do combination therapies? Like, kind of where do you start with patients?
With my first patient assessment, I like to have my patients talk to me. It's at least an hour. Sometimes we'll even have to schedule a second meeting to dive deeper. I tell patients at the beginning, today we might not necessarily prescribe anything. If something seems urgent, we'll definitely work on getting the patient something.
Hmm.
But if it seems like more of a conversation, these symptoms have been going on for some time. A lot of times patients have been working with a therapist and they're not reaching, the goals or feeling how they anticipated after some time.
Hmm.
So we'll talk about everything, different types of therapy, that idea that maybe this particular therapist might not be the best, and that's not a
Hmm.
bad thing to say.
Hmm.
It's like finding a good partner in a relationship, thinking about other things outside of medication, whether it's red light therapy, sauna therapy. Are you exercising? What's your daily movement look like? Are there supplements that you've maybe tried? And talking about all of this, and then also giving an idea of medications that could be an option. One of my favorite things that I do at the beginning of a mental health consultation is I ask patients, what are your goals today? And what do
Mm.
you anticipate the outcome of today's appointment to be? And I think that helps you get a good starting point.
Yeah. No, I think that's perfect. I think that's such a great idea to ask about the goals and what they're wanting. And it really helps them feel like they're a part of their care instead of just be like lack of participation, I guess. I think that's fantastic. So what are some of the therapies that you can offer?
So I refer out. So I do strictly medication management,
Okay.
but I work within a system that has 60 therapists and
Okay.
they each specialize so many different specialties. Partnering them with a good therapist is a way
Hmm.
to start. Something like exposure therapy to help reduce anxiety, or DBT therapy, which teaches emotional regulation, helps with distress and tolerance issues, thinking about diet, nutrition, sunlight, quality of sleep, all of these other non medication things along with the therapy.
Yeah.
I'm really big into, a lot of people, the word frou frou. Is that the correct way to say it?
Yes.
Frou frou things. There is more and more supportive scientific research that is telling us why people have done certain things for many years, thousands of years, and why they work. So breath works is a big one for me.
Hmm.
Patients with anxiety, and especially if that anxiety is more situational, more in the
Mm.
moment, teaching patients to breathe, learning about mindfulness and meditation, stretching, being more connected with the body to help relax that parasympathetic nervous system.
Hmm.
So those as well are a big deal. One that is difficult for patients that I talk about is the environment they're in and the
Mm.
social environment and how they can change them. Now, I have a lot of patients that have anxiety and stress, and they tell me, they have 3 children. Their ages are 5, 6, and 7. They're working 2 jobs. Their husband's working outside of the house. Their mother's sick. So there are things that I can say over and over again, well, just de-stress.
Yeah.
Not always necessary. And that's why I do like the option for medication to help in those times where we look at all of these things, not necessarily able to, affect them in the way that we would like to. So having that tool of medication there is helpful.
Yeah, and I love what you're saying about lifestyle changes and environment changes because now not all of our listeners know, but Sheena and I know each other in real life. And so Sheena knows that I have given up alcohol and I don't go out very often anymore and all of those things and how drastically that has changed my life. And, I've had depression and anxiety probably my entire life, but when I got diagnosed was after my son was born and I fell into terrible postpartum depression, to the point where their dad would come home and been like, there's nothing done and you're laying on the couch. When's the
Mhm.
last time our kids ate? That kind of stuff, like really, really deep. And I was able to get therapy and get on medications and things. And I've been on and off medications for years. I definitely do better on them.
Mhm.
But one of the cool things for me that I mean, alcohol is a depressant. We all know this. But what I didn't realize was how much it was affecting me. I have been able to cut down on my antidepressants since giving up drinking, since, now my sleep is better, my overall health is better, my blood pressure is better. All of these things that came from just giving up this party lifestyle. And I wasn't even that significant. I mean, I wasn't drinking and out partying every night of the week and things like that. It was usually every other weekend when I didn't have my kids and was out. But that made such a significant
Mhm.
impact on my mental health. So I love that you talk to people about that because it's huge.
Yes. And I want to congratulate you again. You're doing amazing with your
Thank you.
goals. And I can even see it, when I see you, just your skin is glowing, your just
Mhm.
mood is always boosted. And we don't realize we accept the alcohol and other substances, as it's a good thing. It's great to go out with friends and
Right.
have a drink, and that's what you surround it with. But for some people, the effects on the body then lead into effects on mental health. So
Mhm.
eliminating things like that, talking about that. There are books that I offer patients that aren't really ready to accept, no alcohol at all, but even just cutting back and seeing
Yep.
I'm sleeping a bit better. Maybe this is helping. And then that sleeping better turns into feeling better the next day, which turns into better productivity at work. So
Yep.
seeing
And
how you
more
can be
money in my
effective.
bank account.
There you go. That's a good positive one.
Yeah, that's been real nice. It's amazing to go out to a bar and order club soda and you leave at the end of the night and throw the bartender a couple bucks for serving you club soda all night. And I don't leave with an $80 bar tab anymore. It's
Yes.
great.
No regrets on that credit card the next day.
Exactly, exactly, which then just spirals the mental health, right? So,
Yes.
yeah, that's fantastic. And I think, the last time you were on here and we talked so much about exercise and overall wellness
Mhm.
and the quality sleep that you get and all of those and how those this is why you do these things that you do, is it transfers into mental health as well. So it's just huge for me to talk about that because I know there are risks associated with medications and other things. And so for me, therapy, lifestyle, those things are so, so huge.
Yes.
And so impactful.
Movement is a big one. And I think we're learning more and more and recognizing it more. Even things on TikTok, it was
Mhm.
really big a couple months ago where someone was on there and they're saying, I'm depressed. And it started listing like, well, did you see the sun
Yeah.
today? Did you get outside today? Have you had a breath of fresh air? Did you drink any water?
Yep.
So thinking about the hierarchy, those basics, looking at those basics that we can affect without jumping to medication. Again, medication, I love it's there. It's a great tool,
Mhm.
but it comes with side effects, as we'll talk
Mhm.
about. So making sure that we're trying to address all of these things that we can before needing to get to those tools is good.
Yeah. Yeah. And if you have the tools in place, then you can continue, like for example in my situation where I have continued to evolve and make lifestyle changes and now I am able to cut back on the medication. And for me in my personal situation, it's not to be off of medication at this
Mhm.
time. I'm okay with that. I can accept that. Some people have difficulty accepting that they need medication. And I was one of those at the beginning. I grew up in an era and a family where you just choose to be happy. Why are
Mhm.
you acting like that? Why are you choosing to be sad, choosing to be anxious? And it took me a long time to get past that stigma, and I'm not choosing this. I can't choose my way out of this. So it was really interesting for me to kind of get past that, be able to accept that just like I have high blood pressure or just like you might have a thyroid issue, you
Mhm.
can have mental health issues. Your neurotransmitters don't necessarily connect correctly, and it's not your fault.
Absolutely. And we can help.
Yeah.
Continue to stress with clients that are really against medication for whatever reason? They talk, about being raised similar to how you mentioned. They think of medication as a failure on their part
Mhm.
or they're giving in to something. I don't think of it that way. It's a tool. I call it a tool. I try not to use the word prescription or medication. This is a tool
Mhm.
that we have available for you. We're going to try this.
Yeah.
This is, the idea of going day to day and allowing your body to feel stress and anxiety and depression, what is that doing to your system overall? It's
Mhm.
affecting your sleep, it's affecting your relationship. So, all of these bad things, down the road. And if we can utilize this tool, we'll be able to decrease these stressors on your body and you'll feel better overall.
Yeah, absolutely. So let's kind of dig into some of these medications and tools, as you say. What are some of the kind of go to prescriptions in the mental health world, and what are pros, cons? Talk to me about it.
We have a couple of classes that we lean on in mental health with neurotransmitters, looking at the brain chemistry, the neural pathways, and seeing what your symptoms are and which medication aligns with helping those systems. Something that's really tricky in mental health, everybody responds differently to medications. So, looking at having, as a provider, my set of favorites, and they're my favorites because they have the least negative side effects. I've seen the most positive outcomes, and they're good for day to day. SSRIs and SNRIs, those are the ones that we hear of most. Lexapro, Zoloft, Lexa, Prozac,
Mhm.
all of those good ones. So they work on blocking serotonin reuptake, increasing the serotonin that's available in the brain. And that's what we are learning that helps stabilize mood and reduce anxiety. We use that for depression, anxiety, OCD, generalized anxiety, PTSD, and then even chronic pain can be helped with these. That class of medications, sexual side effects, weight gain, and emotional blunting. So we're very careful with those. And again, when I'm offering medications, I am making sure to mention all of these potential side effects so patients know. One of my favorites, so an atypical antidepressant, Wellbutrin. So with Wellbutrin, it helps dopamine and norepinephrine reuptake. And that helps with depression and anxiety, but we find that it doesn't have that sexual dysfunction or that
Hmm.
lower libido effects. We can pair that with somebody who's doing like a Prozac or a Lexapro, and they're noticing some decrease in libido or any kind
Mhm.
of sexual side effects. We can add on that Wellbutrin. Again, the Wellbutrin, mirtazapine, they're helpful with depression, sleep issues, ADHD symptoms. And then we have things, mood stabilizers, that's your lithium, lamictal, Depakote, which they're great for bipolar
Mhm.
patients, mania, or cyclical depression. Like they're very, very good. But those medications do come with a bit more of the common side effects.
Mhm.
So, thyroid, we watch for kidney health, liver function, weight gain, and again, the sexual side effects. Because when we're bringing patients down from that mania, that manic state, sometimes people are feeling too blunted. So, just not, seeking that enjoyment. And then we have, our atypical antipsychotics, which I hope they rebrand. I hope they rebrand this class of medication because when you're listening to a patient and some of their symptoms fit to what an atypical antipsychotic can help with, when you use that word antipsychotic, I think it's an automatic turnoff
Yeah.
for patients. They're like, what? Psychotic? No,
Yeah. I'm not psychotic.
that's not what I need.
Right.
But the medications, Abilify, Rexulti, they're actually very helpful with some symptoms that patients have, whether it's mood. Some of my patients that are very irritable, short
Mm.
temperament, it can be really helpful with those types of symptoms when you're somebody with a bipolar, a severe depression, or that agitation and impulsivity.
Mm.
Again, talking about the negative side effects, sexual side effects, weight gain, and just making sure not having that emotional flattening or that blunting.
Mhm.
And a big one that can negatively affect sexually are stimulants. And a lot of people
Mm-hmm.
don't realize that. A lot of people think, the Adderall and Vyvanse, Concerta, Ritalin, they think of them as a stimulating medication. So it's going to, increase everything. Not necessarily for everyone. So
Mm-hmm.
just again, using them when they're right for the right patient at the right time, but having that conversation, are you having any erectile dysfunction that you may not have had? Is your libido down?
Mm-hmm.
Any trouble, in the bedroom? Just asking those questions. So those
You
are
know,
kind of a big overview of a lot of the
Yeah, it's
medications.
interesting to me that being in urology, I've had to kind of pull through why guys are having their ED and learning some of the medications and things like that that aren't in my field. And have you found, because I've had a few guys with this issue, that have difficulty achieving orgasm, reaching climax, being on Vyvanse, Adderall, those different stimulants?
Mm-hmm.
I
Yes.
found that really interesting. I didn't realize that that would be an issue because you think of stimulants like hurrying everything along. You would
Yes.
think it would almost be the opposite, that they would have, orgasm too quickly, a premature ejaculation, but they're having this delayed ejaculation where they just keep having sex or they just can't get to their climax, whether it's sex or masturbation. And that sometimes makes them want to not take their medicine.
Absolutely. And again, some patients are more forthcoming with
Hmm.
information. Some will tell you right away. Like it'll be their first follow-up and they're like, "Hey, hold up. I've noticed something. I've
Yeah.
noticed something
Yeah.
different." And then other patients I got to kind of like ask some questions to get
Hmm.
information. Again, everyone thinks stimulants, so they think like go go go, it's going to
Hmm.
just increase and make everything great, but it does have that negative effect.
Yeah. Yeah, that's so interesting. Okay, so you have patients come in and, you've decided that the best course of treatment for them is, let's say, combination. They're going to go see a therapist, maybe they're going to have some acupuncture, they're going to try one of these medications, and let's say they do come back with these sexual side effects. What do you do to help them with that?
First, I want to see how they're doing on the medication. Is
Mhm.
this medication a benefit? Are we feeling better in other areas? And this is kind of just the one thing that is really bothersome or having a negative effect. Couple of things. Should we lower the dose?
Mm.
Now, just because it's written, this is a starting dose for a patient doesn't mean that I don't have the availability to change that around. So maybe a dose that's lower might be
Mhm.
helpful. Adding a medication that Wellbutrin, if I didn't start them on Wellbutrin and say I started them on like a Zoloft and they're feeling really good otherwise, but just, having difficulty reaching orgasm, we can, and this is male or female,
Mhm.
we can say, let's add Wellbutrin at a low dose. That tends to help. It can help with the libido and helping you reach orgasm. It increases that dopamine and norepinephrine. So let's see if that's a balance. We can add other dopamine boosting agents. Buspar, Mirapex has been used. And then we get to, you know, the conversation. Is this all the time? Is it just you found it in certain times? So could an as needed medication be
Mm.
helpful? And that's where you can come in, something like a Viagra.
Yep.
The good commercials about taking 30 minutes or an hour
Yep.
before needed.
Yep.
And then Cialis, that's the longer acting one.
Mhm.
So I would be able to offer that to a
Mhm.
patient. So we said dose, we said adding on,
Yeah.
and then increasing dopamine naturally. I go back to the exercise, strength training, weightlifting, sunlight, vitamin D, high protein diet, cold showers and sauna, nitric oxide supplements. Have you heard of these?
Yeah. So nitric oxide is super important for arousal for both men and women, but men, we see it because we actually visually see their erection, right? So, but it is important to men and women. It increases the blood flow to our erogenous zones. Well, to everywhere, but when we're talking about sex, we want it in our erogenous zones. And so there are some really great ones. As you know as well, being in this field, we have to be careful about what supplements we take and what brands you trust. So make sure that they're being tested because not all supplements are the same. But nitric oxide really does help increase that blood flow and get you good quality erections. For some guys, that's enough, and they don't need the Viagra and Cialis on top of that. For other guys, it helps to also take the Viagra and Cialis because they still need that dilation of their blood vessels to pull the blood into the penis. And then the nitric oxide obviously helps with that as well. So it is really important. And I do have guys that come in who are seeing a mental health specialist and are doing rock solid on their mental health. Like they're on the right treatment for that. It is great, but they're still having ED because of it, or they're having ejaculation issues because of it. And that we do want to just help then in that situation. And, it is a difficult balance of, do you add another medication and potential other side effects? But I think, and you would probably agree, that if your mental health is on par and you found the right dosing and the right treatment plan there, then we don't want to mess with that.
No, because it's difficult to get there for some patients.
It
So
really is.
if they're doing well, adding that other supportive tool, I think is absolutely ideal.
Yeah, I absolutely agree. And then, we can do, the PDE5s with the Viagra or Cialis, we can do that. If that's not enough for a patient, you can watch the other episodes that we've had on ED, but we have intracavernosal injections that we can teach you how to give them into your penis. And those are all about blood flow, and they don't have any of the other side effects of Viagra and Cialis, which is amazing. So if you are, have significant cardiovascular issues, you're the guy that gets really severe headaches with the Cialis or the Viagra, these are really great options. My guys get freaked out when you tell them that they're going to put a needle in their penis for the first time.
Sure.
But it is a tiny, tiny little needle, and it does a great job, and it's not going to have any interaction with your mental health medications or any other medications. So that's really the benefit of those, because we don't want to complicate an already complicated problem.
With another as needed, again, if somebody's doing great on their mental health and we don't really want to increase or decrease, and the patients are, not necessarily wanting to add prescription, have you used oxytocin?
So I don't usually use oxytocin. We do have some patients that have used it. My go-to for delayed ejaculation is cabergoline. They can take it more as needed. I've had better effects with that. Oxytocin is a little bit more difficult for patients to get as well. But I haven't used it a whole lot. It is out there, and it is a great option for certain patients.
That's one I haven't used, but I've had a couple of patients bring that one up. So I had been researching. Like you said, it is more difficult. Usually a compounding pharmacy is the only place I've found.
Yeah.
But I was just interested. I've heard either it absolutely helps and patients love it, or they tried it and they're like, "Not this wasn't anything."
Yeah, it's definitely a mixed bag. Some of them like it, some of them don't, but it does tend to be very expensive getting it at the compounding pharmacy. There's fewer and fewer compounding pharmacies anymore, which is really unfortunate because compounding pharmacies are fantastic. But it's just, it's not a go-to. Very few people in my practice would even consider prescribing it.
Good to know.
Yeah.
See, I'm always learning more as well.
We all are. That's what makes us better providers. We just keep the conversation going.
One of the other things I wanted to make sure to talk about, and with underlying causes, ruling out if this, is it from the medication? Was it kind of underlying in the medication, maybe exacerbated these symptoms? So making sure patients have good baseline labs, thyroid function, hormone panels, looking at blood glucose. What's their A1C? Have they had that checked? I've, had patients that will send for labs. Oh, I haven't been to the primary care since, 2015. Okay, let's check. And they have an A1C of like 10.
Yeah.
Lipid profiles, and then sleep study to rule out sleep apnea, because people don't realize that affects sexual dysfunction so much as well. Low energy, mood instability. They're going to feel depressed.
Yep.
Is it necessarily a neurotransmitter, or are you just not getting great sleep? So those are other big things to think about, making sure to rule out and looking at the patient as a whole.
Yeah, absolutely. The other thing about sleep apnea that I didn't realize is how much it affects your hormones and your hormone balance. I have guys that come in with low testosterone. We send them for a sleep study. They get on a CPAP, and that alone corrects their low testosterone. We don't even have to put them on supplementation, which is amazing.
I wish more men, we need to scream this from the mountaintops.
Yes.
So,
yes.
Because we see all of these online, a business online, they're, let's jump to testosterone. That should be the last thing that we do. Let's work on fixing these other things. Is it sleep apnea, metabolic health, exercise? Are you exercising? Are you using your muscles? Because we can see lab work where we haven't intervened with a hormone therapy, but making those changes, a boost in testosterone, and the patient feeling that difference.
Yeah. Yeah, for sure. Do you walk around like the dude with the sign that just has this like sign up that says, "Did you exercise today?"
I should. I don't know how tired my patients are of me saying that. Some of them will say it before me. which is actually hilarious. I am very detailed in my note taking for my patients. And when I type things up, I will read them exactly back
Yeah.
the next time they come in. And some of them come in and sit down. They're like, no, I didn't use the Peloton. No, I didn't go to the gym. No, I didn't take the dog for a walk. And I'm like, well,
Right.
we
And what
got
are
to
we
do
doing
these
here? Yeah.
things. I
You
always tell
had
them,
homework.
I tell them to picture like a little Sheena on their shoulder. Like, just think of
I
me
love
there
that.
being like, exercise, exercise.
Yeah, yeah, for sure. That's awesome. It is. It's so huge. But I love that, like you said, this toolbox of all the different things that we can help with and work through. And talking about needing the urologist and the sex therapist and things like that. It is a team effort. It's not, one-stop shop where you're going to walk into my office or Sheena's office and be perfectly fine by the time you walk out. It's a team effort, and we can help with, the full gamut of things if you open up to us and tell us what's really going on.
Yes, it's absolutely holistic, whole patient, looking at every angle. It could be a little bit of what I could help with, a little bit of what you can help with, and a little bit of what a therapist could help with.
Yeah.
I wanted to make sure that we're not, discussing these negative side effects and making people, not want to try SSRIs or other medications because, again, just like you share with your personal story, sometimes they are what is helpful and we do need to be able to reach for them. So I
Absolutely.
think being open as a prescriber,
Mm-hmm.
having that, consent, patient consent, making sure they're understanding what the potential risks are, but why we feel like this is going to be the best for you, explaining other things that we can do.
Mm-hmm.
So understanding that if medication is needed, managing those side effects is absolutely possible. We can do a holistic approach, explore other medications, the lifestyle, ruling out underlying issues, and just being open and having that conversation.
Absolutely. Yeah, absolutely. I mean, I am a poster child for trying all the different things. I think I've tried every SSRI that's out there. And you go through different phases in life. One works really well now, one might work better later. Postpartum for me was very different than I'm almost empty nesting now. And, my stressors and things like that are very different. So I think that's another, drive home point with mental health is your mental health is constantly changing and you need to be open to changing your treatment plan and saying to your provider, hey, this isn't it anymore. Something's not right, whether it's a new side effect that came up or you're just not dealing well anymore or whatever, and being open to trying something new. What you start on day one with your mental health provider is not necessarily what you're going to be on forever.
Absolutely. And if your provider, prescriber seems dismissive of your concerns, I encourage people, second opinion. It depends on the prescriber. And I'm just always willing to have those conversations. Somebody may come up with some idea that I'm just like, absolutely, we're not doing this, but I would never dismiss it. I would have that conversation and educate. Educated patients are the best patients.
Yeah, absolutely. And I don't think that I would be here today if I weren't properly treated and medicated and all of the things with the lifestyle and the help that I've had over the years. So I have the utmost respect for what you do and how you help patients because before I get emotional, I'll stop talking about it because I would not be here today. And so I'm very grateful for what you do and what other people in your field do.
Well, thank you so much.
Yeah.
It's the patients. The patients do all the work. That's what I always tell everybody. When you're doing the work, I'm just here. I'm just the toolbox helping you. You're doing the work.
Yeah. Yeah. It's amazing how our mental health affects every aspect of our life. And, this podcast focusing on the sexual health, that certainly also affects most areas of our life and our relationships and things like that. So it's such a crossover. And I just truly appreciate you being on here today and sharing your wealth of knowledge.
Thank you so much. And I just want to empower everyone, all of our listeners, all of our patients. Ask those questions. Feel open to discuss any concerns about sexual health, your mental health. If you have a patient seeing you, having them feel comfortable to talk about if they're having depressive symptoms, or if a patient is seeing me, being open to talk about their sexual health issues, because we might not be able to help them, but we all connect with each other and we can help refer and help support them.
Absolutely. Absolutely. Awesome. So we will have in the show notes how to get in touch with Sheena if you'd like to work with her. And I am so grateful again for having you here and everyone for watching. And we will see you next time as we get between the sheets.
Thank you so much. Bye, everybody.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.